Dr. Maneesh is MSc Nursing and he is also PhD Nursing. He is working as the assistant professor in the College of Nursing in AIIMS Rishikesh. He has previously worked in AIIMS Jodhpur. His area of interest are evidence-based practice, nursing education, emergency and trauma care. He has more about 50 index publications and more than 30 plus conference presentations. Dr. Maneesh, to please stick to your time. Let it be 10 to 12 minutes so that we can take some questions at the end. Please go ahead.
Thank you, Dr. Sara. Visible.
It's visible. Please go ahead, Dr. Maneesh.
Okay. Thank you so much. So today we'll be talking about IAS Champion. And before moving to my presentation, I would like to quote a by Robert McNamara. He says the brains are like hearts and they go where they are appreciated. So appreciation is a key of anything which, like for any work you like to, we expect from anyone to do. And if there's a positive reinforcement, there's appreciation, I think work would be done in a much better way. And that's what we have, implemented in our, IAS Champion. Vinita, can you move the slide? Or okay. So basically, this IAS Champion, the concept, this was started 2019 when we were celebrating Antimicrobial Awareness Week at the AIIMS Rishikesh. And goal of the IAS Champion was to identify, empower, and train the healthcare professionals. Also to promote the rational use of antimicrobials and reduce the antimicrobial resistance and ensure the adherence to the infection prevention control practices. Also, our goal was to foster a culture of accountability and leadership in antimicrobial stewardship across all the departments of the hospital. Benita, next slide, please. So basically, the IAS champions are the various categories of healthcare workers, plus the various units who are practicing best IAS practices in our hospital. So these are the categories which every year we identify, we choose, we assess, and then we just give them a reward. So IAS champion unit and ward we identify at the time of the entire week. We celebrate the Antimicrobial Awareness Week at AIIMS Rishikesh. And IAS champion faculty. These are few categories: IAS champion nurse, IAS champion operation room nurse, IAS champion hospital attendant, IAS champion housekeeping, then MRC and the security guards. Also the students. Our students are also other part of this IAS champion. Next, please. So what is the process we follow for the IAS championship? So first is formation of team of experts. So team of experts comprises of faculties, then SR, and the nursing personnel, either it's a DNS, Deputy Nursing Superintendent, or Assistant Nursing Superintendent. So 3 members team we form to inspect the different areas, and then we allocate these teams to the different areas. We have around 45 areas in our hospital at present, and which we do, we perform this assessment. And then with the help of a pre-validated checklist, comprises of 45 items, we just, this assessment, we just use it as an assessment tool. And then the inspection is scheduled. I leave a mail to all the team members with their schedule when they are supposed to, assess these areas. Then the evaluation is done by the team of experts. Then areas are shortlisted. So out of 45 areas, 10 areas are shortlisted on the basis of their, performance in relation to the integrated antimicrobial practices. Then further, for the remaining 10 areas are being reassessed by, again, the different team of experts, and final selection is made and select 3 top IAS areas. So already I have spoken about it, the process of IAS champion, the formation of team of experts, then allocation of teams. Next, please. Assessment tools. So as I said, we use a pre-validated 45 item checklist, which basically focuses on knowledge and practice related to infection prevention strategies, then diagnostic stewardship practices, and antimicrobial stewardship practices. So all 45 these items are based on these three domains. So these are the core elements of IAS Champion checklist, that is ASP, IAS, DSP, and ISP practices. Next, please. Next. Already I have discussed about this, and yeah, same I had talked about it. So next, please. Okay. Other than the IAS Champion Ward, we also identify the healthcare workers in different categories, starting from faculties to nursing officer to MRC, then housekeeping. So we know that without the integration of different categories of healthcare workers, achieving our goal is not possible. So therefore, the different categories of healthcare workers are involved, and they basically been how do we do that? For the IAS Champion of Healthcare Workers, we create a Google form. We circulate to all the categories of healthcare workers, and then on the basis of their response, we just call top 5 or top 10 of healthcare workers from all the categories, and we do have a separate kind of interview with all the selected healthcare workers from different categories, and then final top 3 the healthcare workers are being identified. Yeah. Next, please. Okay, so far, if I talk about the various areas and healthcare workers been inspected so far from 2019 to 2024. So from 2019 to 24, around from we have started 22 wards, and now we are inspecting 45 to 44 wards, and around 1,500 healthcare workers are sensitized through this our process of IAS championship. Next. Around 1,200, 300 nurses are also being sensitized through the IAS practice. This our entire process from 2022 to 2024. Next, please. Faculties also we do involve, so around 100, 150 faculties also have been the part of it, and they also been sensitized by this entire process. Next. Hospital attendant, so around it's 400, 450 hospital attendant also being sensitized through the IAS, stewardship practices. Yeah. Housekeeping, so housekeeping 600, around 600 housekeeping staffs also, they have been involved, and they were involved, and they have been sensitized through the process. Security guards also be involved, the security guards, and the security guards we have around 600, 650 security guards also, they have been the part of it since 2020 to 2024. And nowadays what we see is more and more the different categories of healthcare workers are actively participating. The reason is basically they come in contact with all the other categories of healthcare workers, and then there is a mutual exchange of interactions do happen, and then there is a reward for it. So therefore there is active participation from different categories of healthcare workers. Next. So when we have actually since 2019 we are just following this, and then we have faced some of the barriers for this entire process for the IAS championship. So first, the limitation of barrier which we faced was the lack of active participation, but this can be overcome by just motivating them, and then involving each category of healthcare workers, so that there could be active participation from all the healthcare workers. There is a lack of regular feedback, but still we can work on it, and we can improve the regular feedback by just engaging them in periodically. Then lack of motivation from the healthcare workers. So of course, motivation is very important. So we can motivate regularly all the healthcare workers so that they can actively participate in such process. Next, please. So take-off message for everyone is that the initiation of integrated antimicrobial stewardship champion program is not feasible, but also a crucial step for every hospital in India to combat the growing threat of antimicrobial resistance. And there are certain challenges and limitations. These challenges and the limitations always would be there, but we can overcome these challenges by structured planning, capacity building, and committed execution. Next, please. And the success of this IS champion depends on multidisciplinary collaboration. This is very much important. So we have to involve all the categories of healthcare workers. Then only we can, succeed to our goal. And there has to be a continuous education and the leadership support. And if it is implemented honestly, initiate, it has a potential to create a ripple effect and strengthening the antimicrobial stewardship across all the healthcare system, and to contribute the meaningful to the national and the global fight against the AMR. So thanks so much. I hope I just completed within my time limit. If anyone has any queries, I would be happy to answer.